We're almost a week into life without a mandatory indoor mask mandate for most sittings here in South Korea. It surely is a huge step out of the prolonged pandemic life, but that doesn't mean we're done with COVID. For today's On Point, we talk about the last remaining worries and challenges to overcome with Dr. David Kwak from Soon Chun Hyang University. Welcome back to the program, Doctor.
Good morning. Thanks for having me.
Sure. Local health authorities have hinted that complete freedom from masks could happen this May. And also, they're forecasting the possibility of a complete return to pre-pandemic normality by this fall. Doctor, why May and why this fall?
So originally, when they set out their plans to lift the mandates for the mask, especially inside the indoors buildings, was that two out of the four categories are met, and they were namely covering the death rate from the COVID-19 itself, the transmission rates, the vaccine rates, and etc. And because two categories out of the four were met, they were able to go ahead and execute the two-step plan where they lift the mandates for masks in a step-by-step manner. So first step has been met, so we are now no longer mandated to wear the mask, but instead we're still recommended to wear the mask, especially in accordance with the common sense. If we're having any sorts of transmissive infectious diseases, we're strongly recommended to wear the mask. Now, further continuing with the original schedule, if the second part of the plan was to be met, it means that in nationwide response system has to be stepped down from it currently being on red to possibly orange, or to even further lower, yellow. The blue is the lowest out of the four. So we are not at that state yet, and we're hoping that it'll be in that level of the infectious disease coming in May. But also financially, we have currently allocated a separate amount of money to be solely designated for response to the COVID-19 pandemic situation. And I believe Chairman Chung is foreseeing that that would be reallocated back to its normal state of distribution as we had prior to the pandemic, probably hoping this coming fall. It wouldn't, I don't think, would necessarily mean that we're the whole the reality of this physicality or the situation will suddenly return to normalcy in the fall of time, but it is a stepwise plan that they're trying to execute. And those steps could only be taken once certain categories that they set out to be the conditions of would be met. So we have to still see whether or not they would actually happen in May of time and also fall of time.
Right. It sounds like we have one more reason to look forward to warmer weather. Now, students and children can now enjoy classes without masks. But what's concerning is that many children in South Korea have yet to be vaccinated. I'm sure you're pretty aware of that, but no masks and a low vaccination rate. How can we wisely manage this situation?
I think it's primarily through education. So not only for boosting up the vaccination rate among children, but more importantly, teaching our young children and ourselves also that it is common sense to wear the mask and keeping the good hygienic measures, especially when you're having common cold symptoms, when you're having transmissive infectious disease symptoms. I would not now at this point say that it is absolutely mandatory that all children should be vaccinated. But I would further iterate that it is, I think, important at this time that we still try to be careful in every regards to taking care of transmissive diseases. We have seen in the past year, 2 years or so through the pandemic that by wearing the mask, by keeping a certain level of distances, and by washing our hands very thoroughly, we were able to bring down the levels of transmission of other commonly transmitted infectious diseases as well. So going forward, excuse me, going forward, not only for just prevention of COVID-19, I think in order to prevent all kinds of transmissive diseases, as long as we can educate our young children that keeping the good hygienic measures is also what protects them, will be a wise management measure that we can take at this moment.
Sure, keeping hygiene is basic, right? Now, health authorities are also cutting the number of hospital beds for COVID-19 patients. We are much freer now that all those strict rules are removed, but we have one last remaining measure, 7-day quarantine for people who test positive. Now, when will that be lifted? Can we say we're done with COVID when that's gone?
Well, it's very tough for me to personally anticipate when that'll actually happen. It would not necessarily mean that it's the end of the pandemic era. However, it would only mean that things have eased greatly, and we can start consider COVID-19 as another commonly spread air droplet diseases. COVID-19 is quite similar to how we are handling with influenza. Every year or so, influenza and its effect globally is quite different. Some of the years we have it much easy, so the infection rate, the fatality rate is much lower than the other years. However, in rare occasions, it still comes back up and it still kills a lot more people than the other years. It still affects more vulnerable people much more greatly than the other years. I believe facing towards the end of the pandemic era, I think if at all, COVID-19 could become a transmissive disease quite similar to that of influenza, where we see yearly difference or even bi-yearly differences of its fashion in its effect, in its effects in healthcare. So when we say that the quarantine period could be lifted, it only means that we're at a state where we're able to handle COVID-19 with much easier measures, but not so much so that it's completely eradicated and we don't have to worry about it any longer. So I dearly look forward to seeing the lifting of quarantine measures as well, but it's only a measure that we either decide to take on or to discard it for the time being.
Surely. All right. Thank you always for your insights. Have a great day, Dr. Kwak.
Thank you.